Thank you. So we've heard a lot this morning about the need for developing the workforce in genomics to deliver both the genomic medicine service and also the pharmacogenetic agenda as well. And as Munir said, we've got a session just after my talk to really sort of discuss and explore what the educational piece might be. So what I'm going to do in my talk is talk about the work that we've done in the genomics education programme, and to illustrate my talk with some of the resources that we've developed that could be of use to the implementation of the pharmacogenomics agenda. And so I'm not going to preempt anything by saying this is what we should do. So I'm just going to put some things out there. We're going to listen to the discussion in the panel later on. So I'd like to start my talks with just mentioning Health Education England. And that's because I find that quite a lot of people don't know about Health Education England and what its role is in the system. So Health Education England provides system leadership to support the delivery of excellent health care and health improvement to patients and public of England by ensuring that the workforce of today and tomorrow, so that's the current workforce and the prospective workforce, has the right numbers, skills and values and the behaviours at the right time and at the right place. So that's Health Education England. And that's why the Genomics Education Programme, which was established in 2014 with money from Department of Health in the first instance to support the 100,000 Genomes project, was embedded within Health Education England. And we've now moved from funding from the Department of Health through to what's called business as usual within Health Education England. And so that means that there's a longevity in our programme and we're not just on short-term funding, and so we can really think about what the genomics education landscape needs to look like now and in the future. And so the role of the genomics education programme is really to give that coordinated national direction and oversight for the genomic development, education and training in genomics to meet the service delivery needs of the genomic medicine service in its totality. So that's a considerable challenge, actually, when we think about the 1.3 million staff in the NHS at the moment, and also the future staff in training. And these are across multi-professional groups, and we're also, as we all know, in this rapid pace of change. Many people feel that genomics concepts are complex, and we've already heard about the lack of educators to educate, or the lack of availability of educators to educate. And we all know that the NHS staff are time poor and don't have as many opportunities to spend on learning and education as they would like to. And also, the other element that we need to take into consideration is that there are people in the NHS who don't know whether genomics is relevant to their practice and may not be engaged when they should be. And so I've just taken this diagram from the Topol review. So that was a recent review that was commissioned by the Secretary of State called Preparing the Healthcare Workforce to Deliver the Digital Future. And genomics was very much part of that report. And this is just a breakdown of the NHS workforce that sort of helps inform the sorts of numbers of people that we're trying to educate, how many people we might try to reach, and try and think about how we can break down those workforce groups into manageable pieces. So one of our approaches when we're thinking about how to think about this 1.3 million staff is to think in a structured, multi-layered approach. And so that's thinking about the high specialised workforce, which is the workforce that's already engaged in delivering genomic services. So, for example, the clinical geneticists, or the clinical bioinformaticians, or the genomic clinical scientists, but also the specialist clinical workforce, who are the broader mainstreaming clinical workforce, the workforce that we're now really beginning to think about much more as we begin to implement the genomic medicine service, and also the general clinical workforce, which includes the GPs and the wider workforce as well. And also, increasingly and importantly, we need to consider what managers need to know in the NHS, and also, as we mentioned earlier in some of the discussions, the need to engage with patients and the public and wider society in the training and education agenda. But it's really important that we recognise where genomics is relevant, that we're not actually overtraining people when they don't need to know so much. And so we need to think about where it's relevant and what is relevant at their point in their education continuum. So thinking about pre-registration training where you need to know about core genomics knowledge and concepts, post-registration where perhaps it's more about contextualising those concepts, and also what to do about CPPD for individuals who have already completed their training but need to know more, so developing competencies in new areas like genomics that are appropriate to new roles that they are undertaking, and just in time or as required information. So we undertook a genomics training needs analysis, which was a very broad training needs analysis at the beginning of the 100,000 Genomes project. This was undertaken by training and education leads who are based in all of the individual genomic medicine centres. So it's not a perfect study, but what it did do was highlight the 4 different types of people within the NHS. There are those who understand their role in genomics and feel they're adequately equipped, for the time being at least, and those who understand their role in genomics but they have a specific learning need, say for example in recruiting patients to the 100,000 Genomes project at the time. There are those who don't fully understand how genomics relates to their role but they're interested to know more about it, and there are those who don't, as we've mentioned already, those that don't see genomics as being relevant to their role and as such don't think there is a need to learn about it. So I think we could have all come up with those categories without doing a survey, but it is really useful to have that validation that when you actually do ask people about their training needs, that these are the types of responses that you get. And as I said, this is something that we undertook right at the beginning of the 100,000 Genomes project, and it would be quite interesting to do this again, and obviously we would do it a little bit differently. But one of the points that you can make from this is that actually, as a genomics education programme, it's very easy to sort of do a top-down approach and tell people what they need to know, whereas actually we really want to listen to what people think they need to know and what their issues are, to really make sure that people are engaged in our processes. And I think this is something that we can think about in the pharmacogenomics piece as well, is trying to get a feel for what it is that people think about their knowledge and understanding of pharmacogenomics. So how is the Genomics Education programme developing its workforce strategy? So one of the areas that we've started to get much more involved in now is workforce planning. And this hasn't been part of our role in the past, but we're really now, as the Genomic Medicine Service is being commissioned, starting to think about that supply and demand modelling, really trying to look at how we're going to influence the number of training commissions, whether that's for healthcare scientists, whether it's for clinicians, or clinical geneticists, and whether it's for genetic counsellors, but also as we start to move more broadly, thinking about mainstream specialisms as well, and also about other workforce groups like pharmacists too. In particular, we've already done quite a bit of work around ensuring that genomics features in curricula, so this is undergraduate and postgraduate curricula, and we will continue to do this work along with the Royal Colleges and others. And we've also mentioned about supporting educators, and we recognise that it's really important that we do something to support educators. And one of the areas that we've already started working in is in the nursing area, where we've been able to get genomics mentioned in their undergraduate curricula for nursing associates and in the nursing standards. And we're now developing educational resources and a toolkit on our website where nurse educators can access information to guide their lesson plans and their teaching. And we think this is something that could be much more useful in the future, as well as we start to expand that so it's relevant to other professions too. Critical to the work that we do in the Genomics Education Programme is around our networks, or working in networks. And I think we've already heard from Imran about the Academy of Medical Royal Colleges, which the Genomics Education Programme is very much part of. We work directly with the Royal Colleges, with individual professional bodies, with the GLHs and GMCs. And these collaboratives that Sue mentioned in her talk, she talked about the nursing collaborative that's been established, and there's going to be a pharmacy collaborative and a medicine collaborative. And these all have a training and education element to them as well. I think the Genomics Education Programme is best known for its resources, the resources that it produces, either through informal learning or through formal learning. And so we have developed a range of multimedia education and training courses and resources, and we've also developed the Master's Framework, that includes a range of individually accessed CPD modules as well. And these are funded by the programme too. Another new area of work that we're getting involved in is the development of competency frameworks. And this reflects this move towards a more multi-professional approach to working and the need for benchmarks for training to ensure consistency of practice. And very importantly this year, to reach the whole of the NHS workforce, we're going to launch an awareness-raising campaign. Haven't sorted it yet, but we are going to do it. It has been written in the books. And we are aiming to reach 250,000 NHS staff this year. And we're also launching our redesigned website at the end of June 2019. So, looking a little bit more detail at workforce development, and what do we mean by this workforce development piece in genomics. So it's been really important from our workforce planning perspective that we are seen as business as usual in Health Education England. So Health Education England undertakes workforce planning for all of its training commissions. And what we've been working with the central team to undertake a piece of workforce intelligence and gathering data at the moment. And it's the central team that are doing the analysis of that data for us. And this will inform the supply and demand modelling that Health Education England already does based on electronic staff record data collections. And we're hoping to link that to the increased commission of genomic testing as we move through the next few years. And that will lead to increased training commissions that can actually give us the supply of trainees to meet that workforce demand. And in addition, as part of that, we need to think about recruitment and the retention of staff as well. So we know, for example, that we hear, for example, that we're leaching bioinformatics to industry, so we're training them, they spend a couple of years in the NHS, and they move on to Genomics England, and they move on to pharma. And so we've really got to think about how do we keep staff, and we don't have very many of those staff in the first instance, a very new profession in the NHS. What can we do to retain the staff that we've got? What can we do to recruit them back into the NHS if they've left? So the other area that we also need to think about a lot more is about our multi-professional working. So Sue talked about the MDTs and how we need multi-professional groups of staff to deliver the genomic medicine service, and that this is all linked to patient pathways. So looking at very much the genomic touch points in different patient pathways. And in order to drive up consistency of approach, we need to work within our networks of the genomic laboratory hubs and the genomic medicine centres, and in primary care as well. One element that's quite useful in this regard is the development of these multi-professional competency frameworks. So, for example, I'll show you later on, we're working on the patient choice, the new consent model that's being introduced for the genomic medicine service, and looking at multi-professional competencies that guide people in their training and education. And we can think of some other areas as well that might be useful for. And this is something that we can also think in terms of whether it's useful for pharmacogenomics as well. And what we want to do with these competency frameworks and any of the other resources that we do is to try and link them to career pathways and credentialing. So, for example, we might be developing our genomic medicine masters, and people may have got their genomic medicine masters, but the question is, well, what does this count for in terms of my career progression? So I've done this master's, but actually my line manager doesn't recognise it. I've done all this hard work and I'm doing all this new work. Does this mean anything? So we need to think about how can we incorporate these qualifications into a career framework that is recognised and that you can utilise for career progression. In addition, if we manage to increase, and we will manage to increase the number of trainee commissions, how are we going to actually have the capacity within the genomic laboratory hubs and in the clinical genetic services and elsewhere to actually train, say, a rapid influx in the number of trainees? So we need to think about new ways of delivering training, and working in networks perhaps to deliver that training. And we need to think about innovative ways of delivering the education, so thinking about more shared learning, use of online resources rather than a one-to-one style approach of trainer and trainee and educator. In terms of the current workforce, we have a huge job in terms of upskilling the workforce. We need to develop targeted training and education opportunities, and to do that we're working with professionals. We don't, in Genomics Education Programme, do this on our own. We always use a range of subject matter experts to develop our resources with, and we evaluate our resources and review and improve all the time. One of the other areas that we need to think about is skills development. And so if we think about our Genomic Medicine Master's Programme, it doesn't have workplace-based training associated with it. And so we need to think about how do we get people to develop practical on-the-ground skills once they've actually acquired the knowledge base. And equally, we mustn't forget about attitudes and behaviours and professional identities as we move into this multi-professional arena. So I've already mentioned that we also need to develop the prospective workforce and to ensure that the genomics is included in undergraduate and postgraduate curricula. And so, as I mentioned already, we have worked with the nursing curricula, and also we have developed the curricula for the scientist training programmes. We have a suite of STP and HSST programmes for healthcare scientists in genomics, in genetic counselling, in genomics in cancer, and in clinical bioinformatics, but there is more to do in this arena. So we've started to gather the workforce intelligence, and this is the first phase of our workforce planning piece of work. And so we were commissioned by the NHS England Genomics Board to gather workforce intelligence data from the electronic staff record, and also because we already knew that the electronic staff record is not as accurate as we would like it to be, that we also did a direct data collection with the local GLHs and the clinical genetics departments. So we're in the process of analysing the phase 1 data, which was where we collected data from those involved in delivering rare diseases and familial cancer, and we looked at the bioinformaticians, genetic counsellors, genomic clinical scientists, genetic technologists, medical geneticists, and the clinical nurse specialists. Our next phase is cancer, and we're going to be collecting data from histopathologists in molecular pathology, biomedical scientists, etc. And you can read that list yourselves. And I think from this is just the starting point from where we will be trying to gather more workforce intelligence that helps us to model the genomic medicine service workforce. So moving on to our programme of CPD opportunities. So we provide a wide range of free-to-access resources to provide an anytime, anyplace, anywhere approach to education that's tailored to suit the range of professional requirements and the time and the immediate need for education. So we have a range of qualifications that are from formal through to long courses, short courses that only take half an hour maybe, and we produce a wide range of resources, fact sheets, guides, videos and podcasts that I'll be showing you some of these in a minute, as well as a very active website with blog articles and social media. And so over the last few years we've managed to reach 80,000 total staff. This is where we can count that data. We have more than 1,400 people who we have funded to access the master's frameworks. That means so they've all got full master's qualifications. We had 1.8 million web page views, 555,000 resource views. For our courses, we have over 55,000 registrations and 21,000 for our massive open online course registrations. So this gives you an idea of how we're able to reach large numbers of people. We've still got to do more work, obviously, but through this approach, we're able to really try and reach a lot of people in the NHS in terms of it helping increase their knowledge and understanding of genomics. So a little bit about the MSc in Genomic Medicine for those who are unaware of this. This is an academic programme. It has a curriculum that was developed in conjunction with St Mary's, St Mary's, can't remember now. It's not St Mary's in Manchester, it's in London with Mark Caulfield. And it's knowledge-based learning outcomes, it's not skill-based competencies, and it involves interprofessional learning. And the aim of our Genomic Medicine Masters Framework is to increase the layer of people across the NHS that have a higher level of knowledge in genomics so that they can engage with specialist services. They can be involved with the teaching and training of colleagues as students, as Imran mentioned earlier on in his talk, that they can take part in policy discussions and help drive forward those changes locally that are necessary to build genomics within their local patches. And it also is an opportunity for people to develop clinical academic careers if they so wish. This is a point at which they can embark into this area if they have undertaken the full masters. And we're very fortunate that at the moment funding is available for NHS staff to cover their academic fees. And so at the moment we have a contract with 7 Russell Group universities. As I've said, it's a framework, which means you can undertake a full masters or you can undertake an individual CPD module. And we've had more than 1,400 people participate in this programme already. So beginning to build a network of genomic champions across the NHS. And what we're finding, here's just some comments from some of the people who've participated in the course, that it's been particularly valuable to engage with healthcare professionals in other specialties. There's a recognition that there is a need for this type of knowledge, and it's no longer regarded as specialist, it's mainstream. Healthcare staff need to be at skill to understand the benefits and implications of genomic medicine. And one person saying that they're really pleased that the course is pitched at a high level, as this provides a personal challenge. So we have a lot of modules that people can access. There are core modules that you have to do if you're doing the Genomic Medicine Masters, but you can have choice of optional modules as well. So I've just taken the Pharmacogenomics module because this is something that I think we can start to build upon in terms of the repertoire of training and education materials for pharmacogenomics. And I won't go through the list of all the learning outcomes, but this is something that we can think about. How useful is this in terms of how many people might we want to have undertake a pharmacogenomics module as we move forward with this education agenda. So the time is now right to be thinking about this because our contract is coming to an end with our current HEI providers. We now need to think about various elements of our Genomic Medicine Masters around the funding model, but also thinking very much about the delivery model as well. We have a blended learning approach at the moment. There is a push for more online learning to be incorporated. And one of the elements of that is it will drive down the cost of each of the modules, because at the moment they're about £1,000 each. But we can drive down the cost if we have more online learning as well. One of the things that we have been advised to do by the HEIs is streamline the module content. And I think it was interesting in the previous comment on the slide about the fact that the Masters was pitched at a high level. Our HEIs are telling us that it's pitched a little bit too high at the moment and there's too much content in the modules. So we have an opportunity to think about that. And then we also need to think about how the modules fit with career frameworks and can they be used in academic, clinical or scientific practice, so the ACPs and the ASPs as well. So I think it's a really good time now to think about the pharmacogenomics module too and what that content should be and what it should look like as we move forward. So another really good way of reaching a lot of people in their own time, wherever they like to be, is through massive open online learning with the FutureLearn platform. And FutureLearn is a flexible free platform. It's got more than 4 million registered learners, the majority of which are healthcare professionals and students. And when you look through what's available on FutureLearn, there are at least 12 genomics courses at the moment, covering whole genome sequencing, genomics in general, bioinformatics. There's a pharmacogenomics one that's produced by the University of East Anglia, and there's also one on nutrigenomics if you're interested. And so this is a great way of undertaking synchronized learning within a cohort of people. The course is run at maybe 3 times a year or 4 times a year. And you can, many of the courses have a team of expert mentors, so that when you have the sort of online chatting around the course content and the discussion groups, you can have mentors actually make that learning much more rich. It is a dynamic platform. There's use of articles, films, infographics, quizzes and discussions, so it's very engaging, very interesting, and it encourages social learning through interaction with other learners, educators and mentors. So the Genomics Education Programme developed a MOOC on whole genome sequencing. It's currently running and it's in its 2nd week. I think you can still register on this particular run of the course if you like. And it runs across 3 weeks. It's got 3 hours of taking about 3 hours of flexible learning each week. And the first week is on the fundamentals of the genome and its history of sequencing. The second is about the sequencing process and whole genome sequencing. And then the third is much more applied, with whole genome sequencing in practice with patient examples. And we use our scientist trainees in the NHS, our HSSTs and STPs, who are undergoing training in genomic counselling or genomic science and cancer or rare diseases, and our bioinformaticians to mentor the online discussions. And we've had over 20,000 course joiners and 10,000 learners. So you get many more people who sign up for the course, but not all of them actually start the actual course with you. But we've had 10,000 learners through this process already, with overwhelmingly positive feedback from a very mixed cohort of learners, including scientists, clinicians, students, commissioners and patients. So I think the fact that we've got members of the public and patients involved in these courses as well really does enrich the conversations that are going on. For people who are new to genomics and know very little about genomics, we are developing a collection of 8 short online modules that are aimed at health individuals, professionals with limited or no genomics knowledge, or for those who did genomics a long time ago and would just like to refresh their knowledge again before they, say, embark on the Genomic Medicine Masters, for example. And it's designed to take the learner through from genes to proteins, right through to how genomics can be used in clinical practice. They are multimedia and interactive, again featuring quizzes, films and animations and infographics, so very engaging for the learner. They take about half an hour to 40 minutes each to complete, and you can take a test if you wish and get yourself a certificate at the end of that. And this is something that can be used for your CPD as well. So we have 4 of them are up and running on the e-learning for health website. They can be accessed through our own genomics website as well. So please do take a look. And this again is something that we can think about in the pharmacogenomics sphere as being a good basis for people who've never thought about genomics in the past to really sort of upskill themselves with some knowledge before they think about more detailed work on pharmacogenomics. So we've also heard again during the course of this morning that many healthcare professionals like just-in-time information. So many of the GPs don't want to spend forever going off to courses for days and days on end. What they need to know is they need access to rapid-fire information so that they can so they're up to date for the patients that they're seeing in that day. And on the Genomics Education website, we've had we've got a series of genetic conditions fact sheets that are PDFs that are downloadable. We have developed a quick guide to returning results from the 100,000 Genomes project. So this takes you through the issues to consider based on whether there is a confirmed genetic diagnosis, an uncertain result or a negative result. So it's just a little quick guide that is very useful. And we're also, and I think this is going to be something that is going to really develop in the future, working with Kate Tatton-Brown at St George's Medical School, and she's been developing these flashcards, which we are supporting her to do so. And this is in this first instance for primary care physicians who are at the coalface of genomics and who need reactive learning opportunities. And these flashcards, which are online flashcards and not actually physical flashcards, provide an innovative approach to learning where it's based on a case-based scenario, which is the hook. and gives opportunities for extended learning. So there would be a case-based scenario that you would see online. You would be able to click on certain keywords that would help you to drill down into the next layer. So, for example, if it was about BRCA, you might want to look at something more about the BRCA gene, so you could click on BRCA 1 and 2, and you find out more about those genes, or you could click on other elements related to that as well. And so you can sort of drill down over a number of scenarios, and we think this is going to be a really exciting way of getting the information at the right level and not having to deal with too much at any one particular time, and being able to drill down to get further information depending on your need. And this needs to be readily accessible, so where we put these flashcards, where we support the system, really needs to be thought of, and how do we update the content of the flashcards as well. And updating content is something that we really need to think when we're developing resources, because it can quickly become outdated. So another area of work that we've spent a lot of time on is developing a collection of short films, and these are really useful actually. These are peer-to-peer films, and they showcase the impact of genomics in key area of practice. So we now got 5 genomics in medical specialties films that are out. We've seen Jude Hayward already on the screen, so she's our GP. For our GP film, we've got James Ware, Louise Jones, Claire Turnbull, talking about their own areas of specialism on a peer-to-peer basis, and we've developed, and we also support their interviews with a series of infographics on the screen as well. And these are all available on the Genomics Education Programme website and on YouTube as well. We also have a series about Meet the Genomics team for people who want to know more about the professional groups already involved in genomics. So we have one on genomic counsellors, clinical geneticists, clinical bioinformaticians, and our genomic scientist film is due later this summer. And we've also prepared films on genomics in professional groups and have worked on nursing so far. So we have a nursing film and a midwifery film that is due in autumn. So that's another way of very, very quickly reaching your peers in your area of specialism to highlight how genomics has changed their practice in their field. So supporting the Genomic Medicine service is a key part of what we do in the Genomics Education Programme. And so for 1920, we're developing a wide range of educational resources to support these key themes in the Genomic Medicine service, including the patient choice, as I've mentioned already, patient pathways, the National Genomics Information System, and also feedback of results. As I've mentioned already, we're working with the Academy of Medical Royal Colleges and with individual Royal Colleges on these education pathways as well, and working with the NHS England funded Nursing Collaborative, and as Sue mentioned earlier on, we will be working together on a Medicine Collaborative and on a Pharmacy Collaborative as well. And we're establishing our GLH workforce group. So we're doing quite a lot now to help directly support the Genomic Medicine service. I just wanted to mention the cross-professional competency frameworks that we're beginning to move into. And these are frameworks or benchmarks that we're developing in consultation with health professionals and organisations that are based on an evidence-based consensus approach. They're designed as a guide for best practice for those offering genomic tests incorporating professional judgment. And the competencies are benchmarked, in this case for the patient choice exercise, against 4 categories of health professionals. So it's really recognising that there are healthcare professionals who are already trained in these areas. They've been providing consent. They don't need upskilling in counselling skills because they've been doing this for many years, but there are others who would need more background training. So we aim to provide a comprehensive and a consistent foundation across the specialties and with multi-professional working, and it encourages this multidisciplinary engagement as well. And so we're undertaking this at the moment for the new patient choice model for genetic testing. This is almost complete, and tomorrow we're going to start on thinking about a cross-professional competency framework for the feedback of genomic results. So again, this is something, competency frameworks is something that we could really start to think about for pharmacogenomics as well. as one of the sort of tools in our education resource box. So, in summary, the Genomics Education Programme is providing national oversight and expertise and advice to coordinate genomics education and training and workforce development to support the activities of the NHS Genomic Medicine Service, leading on workforce planning and intelligence and activity to inform training commissions, workforce numbers to deliver the Genomic Medicine Service activities. We're focusing on upskilling the existing workforce to deliver the rare diseases, inherited cancer, common cancers and pharmacogenomics through targeted CPD opportunities. We are developing a broad range of innovative resources, both in-house and with our partners and collaborators. We're providing expertise to the development of curricular and competency frameworks, and we're working with networks to aid spread and adoption. So in terms of thinking of the next steps for pharmacogenomics education and training, and there are many next steps, but we need to consider the immediate training and education needs to support the rollout of the pharmacogenomics results from the 100,000 Genomes project and the pilots based on the patient pathways. We want to identify what those training and education interventions might be and what funding might be required to deliver those, including the timescales, and bearing in mind the timescales that if we are to develop some online resources, that takes time. And we need to scope the wider requirements to incorporate pharmacogenomics into all relevant undergraduate and postgraduate training curricula and further requirements for upskilling the workforce, for example, in developing accredited scientific practice and accredited clinical practice. So if you want to find out more about what we're doing on genomics education, please do visit our website, where you can see our articles and guides and just-in-time resources, etc. Follow us on social media, and also have a look on our multimedia, hundreds of educational films and animations and infographics. You're welcome to download our animations and infographics and use them in your talks. And we certainly encourage you to do that. And then just want to say, finally, thank you to the Genomics Education Programme team, who are all based in the West Midlands in Birmingham. Thank you.